A new report suggests schools can and should reopen if they take certain precautions against COVID. The report found that despite more infectious COVID variants, schools can still reopen safely if they enforce protections like mask wearing, social distancing, increased ventilation, and vaccinations. The study was written by the Resolve to Save Lives initiative, which works to prevent epidemics. Former CDC Director Dr. Tom Frieden is the president and CEO of the initiative. Good morning. Thank you for joining us. Your first interview, you said, live in 16 months.
Yeah, a couple thousand from Zoom and Skype, yes.
Yeah,
We're glad to see you in person, too, Tom.
Absolutely. But, you say these things have to happen for the schools to reopen safely. But how likely is it to keep children social distance, keep those masks on, and have the proper ventilation that you're talking about?
There are a few things that we've learned in the past year. One of them is that keeping schools open for in-person learning is enormously important. So our kids can learn, so our economy can grow, so that we can not exacerbate what are already huge inequalities in our society, and that it's possible to do that. We can't underestimate this virus, especially the Delta variant, which is highly infectious. But with a layered approach, it is possible to open schools and keep kids safe.
And we've also seen a number of people talking about the requirements, whether it's the healthcare industry. Do you think teachers should be required to be vaccinated to keep these children safe?
I think we're going to see more and more groups being mandated to be vaccinated. And also, sadly, as the Delta variant drives a big increase in cases in the U.S., we're going to see a lot more cases. I think you're going to see more people being willing to be vaccinated as well.
You mentioned inequalities in society. There are inequalities in schools. There are a lot of overcrowded schools. A lot of them can't afford these updated ventilation systems. What do those schools do?
There are things you can do. First off, vaccinate everyone who can be vaccinated. Second, masking. Masking is really important, and it's painful to see the states that are banning mask mandates in schools, because that's going to cost lives and that's going to cost our kids learning. But you can also make sure that you're finding cases quickly when they occur, and then taking action so they don't spread widely in the schools. And for those few students and teachers who may have underlying health conditions that are quite severe, dialysis patients or others, you have an alternative arrangement.
The report also showed that kids under the age of 10 consistently are very low when it comes to getting COVID cases. Do you think, Tom, that means that all children should wear masks, even the little guys?
At a certain age, kids really can't adhere to wearing masks, but any kid who can should. And the more habit it gets, the more people get used to it and do it. What we know is that we have the tools to stop COVID with masks and vaccination in particular, and it's painful to me as a physician to see that we're not using them. We're not using them, and if we did use them much more effectively, we'd save more lives and we could get our kids back to school and staying in school this fall.
What about sports? Because a lot of the outbreaks have occurred at sporting events.
There are things that need to be held off in schools, choirs, for example, in places where COVID is spreading widely. And we've seen in some contact sports a lot of spread. You have to think about vaccination, and some activities need to be modified when there's a lot of COVID in the community. That's why it's up to all of us to reduce COVID so our kids can learn safely, so our hospitals won't get overwhelmed, and to save lives and get our economy moving.
What's your message? We've said it over and over to your blue in the face. You're turning a shade of blue, Tom, by the way, right now, because we say the Delta variant is like nothing we've ever seen before, that it's more deadly, that only the unvaccinated people are really getting sick. How do we get this message across without being judging and condemning?
Please don't underestimate this virus. That could cost you or someone you love their life.
Dr. Tom Frieden, thank you very much for being with us this morning. We appreciate it. It's great to see you again.